It's working. Hi, good afternoon, everyone. First of all, I would like to thank the conference organizers, RFS, and the other organizers for having ECRI on site today to speak on this topic. My name is Stella Cheong. I am a senior consultant from ECRI Asia Pacific. It's very nice to meet you all. And today I'll be talking about the topic on sustainable healthcare quality through the management of medical technologies. So this is the agenda for our session today. I'm going to give a very quick introduction about ECRI to those who are not familiar with us. And then I'll talk about the concept of sustainability in the realm of healthcare technology management. And then moving on, we will also be sharing about our ECRI Top 10 Healthcare Technology Hazards Report, which we publish every year. And we'll also be talking about diving a bit deeper into some of the topics that we have selected for today. Right? So without further ado, this is a story that I would like to share with you all because I think it really highlights the value and the sentiment behind our organization. So this is Dr. Joel Noble, who is our founder in ECRI. So back in the 60s, he was doing his residency at an ER department in his hospital. What happened was a 4-year-old boy came in needing to be resuscitated. So when he tried to apply the defibrillator on the boy, it failed to discharge, which led to the patient dying. Right. So this very unfortunate scenario actually caused Dr. Noble to channel all his anger and frustration into encouraging and enhancing patient safety. And he did this by testing and evaluating medical devices. So what he did is that he got together a team of engineers, and he also applied for government funding, and he bought 8 different brand models of manual resuscitators available in the market back then, in the 60s. And the thing about back then is that US FDA was regulating medical devices, but they were not very stringent on the regulation. So there were a lot of unsafe medical devices that were being used in hospitals back then, right? So after he tested and evaluated those 8 different brand models of manual resuscitators, he found that more than half of these brand models were unsafe for use. Means there's a potential of harm to another patient or another user. So he thought it was very important to publish these findings and share the information to all hospitals so that they can prevent another death from occurring, right? Another preventable death. So that's where he decided to publish the evaluation report in our ECRI Health Devices Journal. Right, so in 1971 is where we published our first journal. And because of that report, it was shared amongst the hospital and it was a very big issue, right? The US Senate got their hands on the report and they decided to invite Dr. Noble to testify at the US Senate hearings to discuss about the proposed medical device amendment. So that report actually kickstarted US FDA to look more strictly into medical device regulation, right? So just to share with you as well, ECRI, we are an evidence-based practice center, an EPC, and this is designated by the Agency of Healthcare Research and Quality. So this designation is a very important designation to us because it really highlights the value of our products and our reports. It's saying that every work that we do at ECRI, every report that we generate, is all evidence-based, it's all backed by evidence. And ECRI actually stands for ECRI, it stands for Emergency Care Research Institute because we started out testing and evaluating devices used in the emergency care setting. But since then, we have expanded our scope to look at all types of devices, all types of systems used across all care settings in the hospital, right? So ECRI, besides providing medical technology resources, we are also a patient safety organization, and this is also designated by the US Human and Health Services. So as a patient safety organization, we receive patient safety events from hospitals. So for example, if a patient was harmed in the delivery of care, so they have to submit that report to us, to ECRI. We'll work together with the hospitals to investigate the event, come up with the root cause, and identify the contributing factors, and then working together with patient safety experts to come up with recommendations and strategies to help hospitals improve their processes and improve patient safety, right? So we are also sister organizations with ISMP, the Institute for Safe Medication Practices, which is also another non-profit organization focusing on medication safety. And we are also a institutional member of ASQA, the Asian Society for Quality in Healthcare. This is just a slide to show you the relationship and type of partnerships that we have across the globe. So we have very close relationships with US FDA, AHRQ, and even in Asia Pacific, we have very close relationships with accreditation bodies, Ministry of Health, and all the hospitals as well. Right, so we are a US organization with our US office in Plymouth Meeting. For me, I'm from the Asia Pacific Regional Office in Malaysia. We also have offices in UK and in Middle East. All right, so that's about ECRI. If you have any questions, please reach out to me. And just before we start, we actually have a booth right there, if you can see, next to the very nice smart AI assistant booth right there. We don't really have any banners for now because we're trying to adopt a more sustainable approach. But if you have any questions about ECRI and about the topic that we're going to discuss, please feel free to approach our booth. All right. So without further ado, let's talk about HTM. So HTM stands for Healthcare Technology Management. And when we're talking about HTM, it's really all about the life cycle of a medical equipment. So starting from the planning phase, where you're looking at performing needs assessment to identify what kind of technologies that you require in your hospital. And this is where you usually align it with your clinical requirements and clinical needs. And even including the procurement or the acquisition stage, where you need to think about the technical specification requirements for your technology, and having an evidence-based procurement process in place to help you identify which is the most safe, most efficient medical technologies or brand model out there in the market for you to match with your hospital's goals and goals. So once you have the equipment in your hospital, that's where the management phases come in. This is where you need to properly maintain it. It's all about the maintenance, performing TNC, PPM, CM, safety management, for example, tracking your recalls, alerts, and hazards, and having a process in place to identify risks and to also mitigate those identified risks. And HTM also consists of the end of life for the medical equipment, including determining when do you BER the equipment, so beyond economical repair. How do you come to the decision to replace the equipment? So all these A to Z of a medical equipment life cycle is what we mean by healthcare technology management. And why HTM is so important is because it indirectly and directly impacts patient safety. Right, it contributes directly to patient safety. Because when you're using safe and effective equipment, when you're buying safe and effective equipment and you are using them in a correct and safe manner, if you're maintaining the equipment effectively, this leads to improved clinical outcomes and quality. And even from the business point of view, it allows you to have better financial stewardship in the sense that your equipment will last longer, they have longer lifespans. And not only that, your maintenance costs can be optimized, which means you have more ability to make better investments or bigger investments in the future for your hospitals, right? So when we think about sustainability, in the typical context, I think what we have in our mind will be ESG, right? Environmental, social, and also governance. And these are some of the sustainable initiatives that are carried out in healthcare. So for example, this is a practice that is being implemented in hospitals that we see in hospitals in the US and also in Australia, where they are switching out the type of anesthesia gases to a more eco-friendly alternative and also a more cost-effective alternative. As you can see here, it says that Okay, it has reduced the greenhouse gas emission by 78% and is saving 2.4 million USD annually. So this is a very big change, right? Other examples of sustainability in healthcare is really about, encouraging the use of renewable resources and energy, reducing your energy consumption, reducing your waste generated. So for example, using reusable gowns instead of single-use gowns, right? Limiting the use of single-use endoscopes for patients in need rather than using it for all your patients. So there's a lot of these little initiatives being done in the whole supply chain movement in a hospital, right? So for today's discussion, we want to talk about sustainability in the context of HTM. So in the context of healthcare technology management, what exactly do we mean by sustainable? Okay, so right now, the HTM processes that we have, it allows us to have safe and capable technology. It allows us to have a very basic risk management process in place, and this includes managing, tracking your alerts, having a risk classification system for our medical devices, right? Having a process in place to manage any medical device-related incidents. So this allows us to have good patient outcome, okay? But in the future, eventually we want the HTM processes to allow us to have sustainable outcomes, and even the HTM process itself to be sustainable. What do we have to do is that we want to be able to predict, proactively control risks, right? So having a proactive approach in identifying the risks related to your medical devices and the management process, as well as optimizing your workflow and processes where possible to optimize your spend, for example, and your policies and processes in the HTM process. And at the same time, keeping in mind ESG and resiliency, right? So, for example, in the planning of medical equipment, while you need to plan to meet your current clinical needs, you also need to plan for the future. So understanding what are your future requirements, understanding what are some of the newer technologies out there that could potentially impact patient outcomes, these are all important considerations that we have to have in the HCM process in order to be more sustainable. All right. Okay. So as we all know, healthcare is rapidly evolving, it's continuously changing. There are new care processes and new clinical applications and new technologies coming out and being introduced every day. So for example, we're seeing a lot of telehealth solutions out there because of the pandemic, but we're also seeing more trends in hospital at home. So caring for patients at home to reduce the length of stay in the hospital, right? And newer technologies, for example, we see a lot of AI applications. In this room as well, we have quite a few of vendors offering AI applications, as well as hybrid imaging modalities, so interoperative MRI, CT, and so on. So with all these new technologies and new care processes, how do we then effectively manage HTM while at the same time ensuring long-term sustainability? So that is a big question, right? And so we're seeing a trend in hospitals where they are trying to consolidate their processes in terms of asset management across all their hospitals, but it's more challenging than said, right? For example, taking into consideration the consolidation of medical assets, taking something as simple as the naming convention of the medical equipment. So, for example, you have a ventilator. Different people will call it a different name. You have people who say ventilator, yes, people who say ventilation unit, ventilator system. So in the end, how do you then consolidate all this to standardize all the naming conventions for all your equipments across the facilities? It will require a lot of time and resources that we know hospitals have some limitations in. Right? And another point here is that hospitals we all have differing practices and SOPs across our health facilities, even different levels of HTM. So when you're trying to consolidate and standardize processes across the facility, this proves to be a very challenging point for us to consider. All right, and without a proper good HTM process, it can lead to poor outcomes. So for example, here we have a few. You will have some very unorganized HTM processes in place where you may have unstructured preventive maintenance. You may not have uniform quality assurance in your service delivery and standards. And you may be relying on an external service provider to manage majority of your maintenance activities. And this is, we wouldn't encourage it because most of the time you'll be relying on them for any spare parts and also for any corrective maintenance activities, which then leads to more uncertainty and unpredictable costs and expenditures, right? And at ECRI, we always talk about, wanting to elevate the status of biomedical engineers into a technology expert or technology consultant, where your clinical users, your C-levels in a hospital can approach BMEs to get technology guidance and advice instead of them just being a repairman, for example. So by having a proper HTM process in place, where you are proactively identifying, emerging technologies and other considerations, that allows the BMEs to have a bigger voice in the room and allows them to provide more support to the hospital planning committee. So some of the examples of the undesired outcomes when you have poor HTM practices. So this is a very infamous event or incident that happened in Vietnam a few years back, where a few patients, 7 patients died, and a lot more were hospitalized and in the ICU. So this happened because of a very small misstep, where the service provider, they were maintaining the water system for the dialysis machines, and unfortunately, they accidentally missed out the last step of the process, which is to flush out the chlorine from the water system, right? So they missed that step. And the next morning, when all the patients came in for their dialysis treatment, unfortunately, the BME manager didn't check whether or not the processes was done correctly. And then the doctor on call as well, they didn't really check on the water system before they started treatment on the patients. And as a result, chlorine was entered into the patient's blood system, and it caused a lot of patient death and harm. So as a result, also the service provider, the BME manager, even the CEO, I believe the CEO of the hospitals and the physician on call that day, they were all sentenced to jail. Yeah. So something so small can actually have such a big consequence, right? It really makes you think. Another example, in Hong Kong, I think recently, maybe 2 years ago, there was an incident where the operating light just came crashing down on the OT table. Luckily, there was no surgery being performed, so no patients were harmed. So when they did a root cause analysis and an investigation, they found that it was because of some loose screws due to metal fatigue, right? And they also said that these signs would have been recognized and identified if checks had been carried out properly, right? So it really shows you such a small misstep in the entire HTM process. In missing out just one step in the IPM checklist, it can lead to such huge consequences, all right? So HTM is, so what do we mean by having a sustainable approach in HTM? We are gonna give you a few suggestions, and maybe we can take some questions after this. But we believe that sustainable HTM starts with planning, right? So planning in your medical equipment includes making sure that the technology that you're planning and procuring are safe and effective, and you have an evidence-based process involved to test and verify the effectiveness of these technologies. So this can include performing clinical evidence reviews, performing healthcare technology assessments, reviewing all those HTA reports available on the different resources, right? To really understand, will this provide me the clinical outcome that I want, all right? And it's also important to have a multidisciplinary involvement in this process. So a lot of times, the decision to buy a brand model really falls back to the doctors on their own wish list. But it's really important to also involve the procurement department, the BMEs, your IT department as well, your facility, risk management, and so on, to really get their opinion and suggestions in the entire process. And of course, we also must understand what is the emerging direction of care and services versus the current state of technology. And we can do this by performing horizon scanning to identify what would be the new techs or new application that have the potential to really impact or change how patient care is being conducted now. Right, and of course, building in ESG considerations. This is an example of building in ESG considerations into procurement decisions. So one of our clients, which is a very big financial institution, part of their requirements is to include ESG considerations into their tender process. So as part of your technical specifications, when you are buying medical equipment, you should have this built into place. Another example that I can think of is for the purchase or planning of medical imaging technologies, for example, your MRIs or your CTs, you can ask your vendors, what is the energy consumption rate for the equipment when it is in scanning mode, in idle mode, or even in standby mode. And having those considerations in place in your whole planning and evaluation process, that would definitely contribute to better sustainability as well. Right, this is predictive replacement planning, right? So this assesses high investment value medical devices. So for example, your higher value devices, your bigger devices like CT, MRI, Linex, nuclear medicine devices, and also your high volume devices. These are devices that you are using in all care settings across all care areas. For example, your patient monitors and your infusion pumps. So this assesses these medical equipment in order to develop a 3 to 5 years medical equipment replacement plan. And the purpose of this is really to provide you a view of the foreseeable medical equipment investment requirements for the future. So in the entire process of coming out with an equipment replacement plan, you need to consider a lot of factors, including your equipment age, your equipment reliability, your maintenance data, device reliability, I mentioned that, device reliability, device utilization, and so on, along with considering the changes in your technologies as well as the alignment with your hospital goals and objectives. So the result of this will be a 5-year plan that allows you to allocate better budget for the future, but better planning for the future as well. So these are a bit more points, and I think we'll be sharing the handouts with you, but you can go through some of the points here. So the entire objective of PRP is really to improve your patient outcome by ensuring the equipment are replaced before it fails to ensure patients are safe. It also allows you the opportunity to have more cost savings, right? Because you're proactively planning and budgeting for equipment replacements. It also optimizes the efficiency of maintenance in a sense that it will help you reduce equipment downtime and also allow you to optimize the scheduling of the maintenance. So there's also an opportunity for you to standardize your equipment. So standardization here, equipment standardization. So this will allow you to kind of narrow down all your equipment into one or a few vendors, and this will allow you to have easier management and maintenance for your BME staff and your BME department. And when we talk about cybersecurity, this is a very hot topic as well. So having a PRP plan will allow you to identify which medical equipment in your hospital has maybe is going into obsolescence, where maybe the operating system can no longer be updated. Right, so this will allow you to identify them and plan for their replacement. All right. So the next suggestions that we have is asset management, standardization of your asset management. And this is an initiative that we see being implemented in countries like US and in Australia, where from a group level as well as a state level and a national level, for example, in New Zealand, where they're trying to consolidate all of their health facilities and health systems. So some of the initiatives that are being done is utilizing a centralized CMMS system across the entire system. They're also trying to standardize a medical asset nomenclature across their health system and consolidating all the device IFUs, service manuals, as well as having the minimum maintenance requirements for all brand models used in the systems in one central library where your BMEs, your users can access to get the information on your hands instantly. And why is this initiative being carried out? It's because it allows you to have a more transparent process in place, and it allows for a more auditable process, right? So as you can see in the pyramid, there are some of the benefits of having a data standardization effort. So it allows you to benchmark your current asset management practices here. It also allows you to standardize all your operating procedures for your workflow management across all hospitals. It allows you to improve your asset portfolio planning. So one example that I can share with you is in New Zealand, where during the pandemic, they were having difficulty trying to see where their ventilator devices are in the country, because there are some areas that really required more ventilators at a point of time. So that's why they have initiated this, this effort in standardizing their asset management list, so that in the future, should another pandemic happen, they'll be able to have a bird's eye view into where their ventilators are being distributed across the country. And if needed, then they can coordinate and redistribute them to areas where it is needed more, all right? And this effort also allows you to have more advanced analytics, where you're able to do more data analysis to improve and optimize your workflows. Another initiative that we see being implemented in Australia is a peer review process. So this is a peer-to-peer audit of the BME services. So basically, you have different BME departments that come together to objectively assess and identify gaps and areas of improvement in another BME department. So this is a learning process where it allows for continuous improvement across the BME departments. So the last one here is on risk profiling. All right. So risk profiling is all about proactive risk identification and management and control of those identified risks. And the reason why ECRI came up with this concept is because we realized nowadays we classify risk based on the severity of harm the equipment can have the potential to cause. However, we realize that the real risk of the medical equipment really depends on the environment of use and depends on the clinical application. So take for example, a very simple device like a weighing scale, right, a patient weighing scale. If used in an outpatient department versus used in a chemotherapy treatment center, for example, the risk will be different, because in the chemotherapy department, you're using the weight of the patient. You're using the weight of the patient to prescribe a weight dose drug for your patients, right? So hence the risk will be higher in the chemotherapy department. So as you can see here, in terms of risk profiling, we have identified 3 main domains that we have to take into consideration: people, process, and technology. People will be your users, your patients, your all the stakeholders involved in the entire workflow. Processes will be the device operation and also the clinical application of the device, looking at the clinical workflow and processes and environment of use where the device is being operated and maintained. And the technology itself, so looking at what type of clinical data it contains and provides to your clinicians, looking at the level of integration and connectivity the device has, as well as the maintenance data of the device. So by considering all these factors, we are able to come up with a list of risks for each and every medical devices in each and every care setting. And that will allow us the opportunity to come up with better strategies to mitigate those risks. All right. So you might be wondering, where do we start? Right? Where do we start in this process? Okay. This is a very simple framework that I'm sharing with you here, and I'm pretty sure we all are aware of it. But it basically starts with the identification of gaps, and this is where we need to assess our own processes. You can do it internally by having self-assessments, or you can even engage with external consultants to help you come in and do an audit of your processes to identify areas of improvement, right? So once you have those gaps, you need to come up with strategies to help you mitigate those risks. And it's really important to have multidisciplinary involvement in this step to ensure that you have a very comprehensive solutions that is not in silo, right? So once you have the strategies, you implement them. You can start small by having a pilot study and then scale up once that is successful. And of course, establishing a monitoring parameter or monitoring measures to ensure that there is a continuous improvement opportunity to your, for your strategies. So one example of a verification process is ECRI's Biomedical Engineering Certification Program. Once you have achieved a certain level of HDM, to further elevate yourself or further elevate your process, you can seek for external validation through a certification program. And this is just one of many, but because it's ECRI, I'm sharing with you here. This is where we basically come in to the BME department. We perform an audit to identify any compliance gaps, and then if we find that the hospital or the BME department has reached a certain level of HDM, then we will proceed with the certification program. Right. So this is an opportunity for service providers or BME departments to stand out from the others, to be a bit more, to stand out from the other service providers out there in the market, right? And one more point, it also supports other accreditation processes. Sorry. Yeah, it also supports other accreditation processes by helping you identify where are the areas for improvement so that in the future you can have better workflow, better processes in place to help you then achieve the accreditation journey. So I just want to share with you and also congratulate RFS for successfully achieving this certification. And this certification was done in 2022, I believe. And you can see on the left here is my regional director, Mr. Eric, with Prof. Aram, the previous director. So this was a very long journey for RFS, where we worked together with them to guide them in identifying the gaps so that they can improve their processes and so on. Yeah, so congratulations. So another way of identifying gaps is by keeping abreast of new technology changes or new technology trends. And one of the ways to do this is by doing your research, right? Horizon scanning for new technology trends and so on. So this is ECRI's top 10 health technology hazards for 2024. And this is a report that we publish every year to highlight to hospitals, to BME departments of potential hazards that may impact patient safety and also user safety. So these are the 10 topics, and I will dive deeper into them in the second part of this presentation. But as a summary slide for the HTM topic, so it's really important to have an effective HTM process because that will in turn lead you to better sustainable outcomes. I think as Dr. Concat mentioned earlier, process outcome to quality outcome. I really second his statement there. Making sure that your processes are enhanced within the HDM process will also allow you to have better patient outcome as well as better medical equipment maintenance and management outcomes as well. And of course, it's important to involve your multidisciplinary stakeholders throughout the entire asset management process, and having a very strong consideration of people, process, and technologies in all stages of the system is, I think, is vital to the mission as well. All right. So without further ado, let's go into the top 10 health technology hazards for 2024. All right. So this is a report published by ECRI every year, and we've been publishing this since 2007, so it's been over 15 years. And the goal itself is to identify potential hazards that have the potential to either cause injury or harm to patients, to your staff, or even to bystanders. Right. And the reason why we share this information with our readers is because it is part of our organization's mandate to share about, improving your processes and mitigating all these preventable risks in the organization. And one key feature of this list, of this report, is that it is not entirely retrospective. It is also meant to be predictive. So some of these items that you see on the list here might not be applicable to you. You might find that, oh, this is not very relevant to me now. But we think that in the future, once you have maybe in the future where you adopt more and more devices, more and more systems, then it becomes more relevant to you. So I think it's important as well for you to know about all these issues, for you to plan for the future. You might be wondering, how do we come up with the topics on the list? So it's through a lot of activities that ECRI does. So as I mentioned, we perform independent evaluation and testing of medical devices. So for example, when we're testing a device or maybe investigating a medical device incident, for example, and if we come across a problem that we think, oh, our BMEs should know about this, hospitals should know about this, then we will take the topic into consideration to be placed on this top 10 report. But other than that, we also assess a lot of healthcare practices. For example, we perform clinical evidence reviews and assessments of new clinical applications of technologies and so on. So through those activities, by also reviewing literatures, speaking with stakeholders, experts, your doctors and hospitals, even manufacturers, we're able to identify these topics to be shortlisted in our top 10 report. And when we are considering the topic, we have a few criteria, right? A few criteria here where we're looking at, how much harm will it cause the patient or staff? How often will it happen? Will it affect all hospitals? And do hospitals know how to deal with the issue? Right? So those are the criteria that we consider when coming up with the list. So again, this is the top 10 for the year. We can share with you the executive brief if you're interested. Please feel free to approach our booth for that. But for today's session, I will just be focusing on these 3 topics here, all right, that we think is more relevant for today. So the first topic is number 5 on the list, which is on AI systems use in medical technologies. So nowadays, we see more and more AI applications being implemented and adopted by healthcare organizations. There are a lot of workflow aids where, for example, AI that is used to help with patient positioning for a CT or MRI scan, which then leads to lower scanning time or lower procedure time. And for example, automated scheduling for your patients as well. There's also diagnostic aids. For example, AI systems that are used to interpret your patient images, or even AI systems used to analyze your patient records to identify trends to help with the diagnosis of the patient, right? So we have all these AI applications, and they promise us that they can speed up processes and they can assist us in clinical decisions. However, AI results mainly depends on the algorithm that they use and also the data on which they are trained. So when it comes to the algorithm, most of these manufacturers, they are not open to share the methodology in which the AI the AI system makes a decision or comes to a conclusion, right? As a result, we have very little visibility and transparency into how it makes a decision. So it makes it difficult for us to verify the effectiveness of the system on our patients, right? Another part is the data on which it is trained. I can say most of these AI applications are trained using data created in the West, in the Western countries, where maybe their patient population are physically have a different characteristics than our Asian physical characteristics, right? So if it's used on our patient population in Asia, perhaps that can cause a different conclusion to be made, right? It can affect the conclusion made by the AI system. And another point here is that we have considered quite little experience with these emerging technologies. Right? Even though we see a lot of hospitals adopting new AI applications, a lot of times we don't fully understand the benefits and the risks of these applications. Right? So making sure that we try our best to mitigate all this is really important when it comes to AI. On the right here is an example of a software. So this is a very widely used sepsis detection prediction model in hospitals. There was a study done to identify the effectiveness of this model, and they found that it missed 2/3 of sepsis patients and generated numerous amounts of false alerts. Right. So as you can see, even though it's a very widely used, popular AI system, there can be risks involved. So it's really important we identify, we put measures in safeguards in place to mitigate this risk. So some of the key recommendations that we have is that we must establish an AI governance program. And this, we need to involve multidisciplinary involvement as well, including your legal team, because of the legal consequences that AI may have, and we have seen lots of these cases online, including your C-levels, your BMEs, your IT, your users, and so on. We need to define the policies required in assessing, implementing, and monitoring these systems. These systems include devices and systems that include that has this AI system. So when you're considering an AI system, it's very important for you to assess the risk. And there are a few, I think, frameworks available online for you to guide you in assessing the risk of AI systems. And we also need to determine the impact of that risk on our patient care. During procurement, we need to test whether or not the system works with our population. So what we can do is we can request a vendor to do a very small test on our own, maybe past patient history data to verify whether the system works for our patients. And after implementation, of course, it's really important to monitor the performance and maintain the system over time. All right? So moving on to the next. Sorry, how much time do I have? Half an hour? 10 minutes? 15. Okay. Number 6 on the list, second the topic that I would like to share with you today is on ransomware. So more and more hospitals are being faced with this ransomware attack issue. And the reason why healthcare facilities are a very attractive target is because we have very valuable sensitive data. And because we're dealing with patient life, there's a very critical need to restore operations quickly. So that's why these hackers, they are targeting healthcare facilities because they know that they can apply more pressure on us to extract a ransom, right? But when a hospital is affected with ransomware, it really leads to a decrease in patient care quality, in a sense that it can lead to delay in your patient care, it can lead to cancellation in your patient appointments, and so on. And it can also prompt the switch to a more manual process. For example, if you get a ransomware attack, you need to shut down your IT systems to prevent further damage, right? So then on the ground, your users will have to revert back to a manual paper process, and that is extremely complicated and a lot of risk involved. And additionally, the data that clinicians need to access to make the clinical decisions is also not available for them, right? So this can lead to higher patient harm, right? So these are some examples of our recent ransomware. So as you can see, the result of these ransomware attacks is legal complications, and legal complications mean very high financial burden for the hospital, right? So in terms of the recommendations, ECRI is recommending you to deploy a framework, have a framework implemented to identify, detect, protect, and also respond to these risks and threats. And again, there are a lot of frameworks available. For example, from the National Institute of Science and Technology, NIST, they have a cybersecurity framework that you can adopt and follow to help you identify and come up with strategies to prevent all these ransomware risks. On a hospital level, what we can practice is that we can configure internet-facing systems securely. So this includes your EMRs, your VPNs, your staff emails, and so on, making sure that you have multi-factorial authentication implemented for them. You have network segmentation with strong firewalls implemented, and of course, having a backup and recovery method. And this includes a backup process. So if in the chance that your hospital is attacked, so what do you do? What is the policy in place to help you guide through that incident, right? So as part of this report, we are also posing a challenge to our policymakers here, because we realize that at a hospital level, all these protective measures are only a safeguard, but it is not foolproof. So what we really need from the policymakers is proactive preventive policies to help us and guide us in developing these programs, these security programs. And this includes developing new policies, training and educating and building up a security workforce that can help us mitigate and deal with these incidents, right? So lastly, the last topic for my session here is on infusion pump damage. Now this is not a new topic, but I think it's worth mentioning again because of an incident that we detected in our investigation process, and I'll share more later on. So infusion pumps are used throughout your care system, right, in all care settings. And a lot of times they are being pushed around, being pushed with the patients, taken down from the IV pole, put it back up again. So all these wear and tears, mishandling and misuse, it can lead to damage to the infusion pump, right? And when there's damage to the infusion pump, there's a chance where it can cause or result in medication error, so medication administration error. And it can also cause in delay in therapy. For example, if a nurse comes across a damaged infusion pump, they have to waste their time to go find for a suitable pump to replace the damaged one. So that directly results in a delay in therapy, right? But the challenge here is that sometimes infusion pump damages can be hard to detect, right? So an example here that that ECRI came across recently. So this is one of the very popular pump used in hospitals, and this was only published last year, right? So this is where a patient had gravity-free flow into medication administered, which was not intended. So when we did our investigation, we found that it was because it didn't have the component that allowed, that controlled the pump flow, the flow of the pump. So this resulted in unexpected gravity administration of at a very high flow rate, which caused patient harm in this, right? So on the right here, you can see the pictures from our investigation process. And one fact of this incident is that this error went unnoticed for a couple of weeks, right? And it was only noticed when this particular patient was harmed. But imagine throughout the whole week, through the weeks that it was unnoticed, the potential of risk and harm it could have caused more patients, right? So the key recommendations here, I think, are quite basic infusion pump workflows and safety mechanisms that you probably are already familiar with, but I think it's worth refreshing our memories and refreshing ourselves with the measures here. So for clinicians, for your users, for your nurses, make sure that they understand how to detect if a pump is damaged and to not use a pump if it's visibly damaged, and also to identify failure modes. So if there are any failure modes or common signs of pump damage, users themselves have to understand and identify them and send them to the BME department for repair. Right. And this is also a challenge to the industry. So industry meaning our manufacturers of infusion pumps. We need to facilitate better processes in the use and maintenance of infusion pump. And one way that we can do this is to facilitate proper cleaning and disinfection. Because a lot of the times, pump damage can result from using improper cleaning, disinfection reagents or liquids on the pump, which then compromises the integrity of the pump modules, leading to further damage. So what the industry can do is to facilitate this cleaning process by providing realistic and practical cleaning steps to our users, and also providing job aids, for example, posters or infographics to make the process easier to understand and easier to be conducted. There's also an opportunity here to improve your device design. So we need to look for ways to improve the technology. For example, using materials that can withstand cleaning with a greater variety of chemicals, minimizing the use of damage-prone connectors, minimizing moving parts, and also pursue designs that prevent gravity flow. So these are just some of the basic infusion pump safety measures that we have. These are a summary, so there will be more in the full report. And again, you can approach our here, and I'm happy to share with you. So with that, I'll end my presentation. Thank you very much. ขอบคุณค่ะ